People are dying because clinics are in crisis. This is also driving the continuing HIV epidemic. The blunt findings of a report by the Ritshidze Project on the state of public sector facilities here in Gauteng. The organization's Bellinda Setshogelo joins me now on lunchtime. Bellinda, good afternoon to you and welcome. To what extent then is the crisis in clinics in this province being made worse by COVID-19?
Thank you for the opportunity. The situation has worsened during the COVID-19 pandemic, whereby we've lost a lot of people on care. One of the reports that was articulated during the COVID, it was there were 10,000 patients that didn't come forward to collect their ARVs during the COVID. One of the reasons was that patients disengaged to care because in the facilities they were handed their medication in the fence. That has also contributed in extending the long waiting times that were already there, even prior to COVID. And there were also fear of patients contracting COVID. That's one of the elements. And during the lockdown also there were problems of transport. People couldn't reach facilities, and as the country, we have not done much in terms of having strategies to try and reach people prior to pronouncing the lockdown.
So part of the problem is wait time. In fact, your data says that people spend an average of 4.5 hours at clinics here in Gauteng. Your monitors have observed over 200 people at any given point waiting to be seen. But that is also driven by insufficient staff numbers. What do those percentages look like?
So the other point in that is that around May 2019, the Department of Health has issued a circular that says facilities need to open around 5 and have extended hours. But when we did the monitoring surveys in facilities, we realized that most of the facilities, they're not implementing that circular. Some are not even aware. Some say they will not do it because the department have not brought in resources to do that. So business is running as usual, despite the policies that are meant to strengthen service delivery in facilities. Patients wait for more than 5 hours in the facilities, and most arrive as early as 4 a.m. in the morning in situations where it's not safe. The arrives of gender-based violence. There are mothers with young babies waiting outside the facility in the street to be seen in the clinic. And some of them, when like 3 o'clock, 4 o'clock, some facilities will cut the line and turn them away. That results in people either disengaging to care, not wanting to come back to facility due to such circumstances.
Do you believe the situation right now is worse than it's ever been before?
The situation has never changed. The organizations, the PLHIV sector in different times have raised this, that our healthcare system is in shambles. And although we have good policies, we have our constitution that everybody has a right to quality healthcare services. But the reality when you go to the ground to access healthcare, it's not the same. There is no quality, there is no confidentiality. People, instead of receiving 2 to 3 months supply of ARVs, they receive in tissue papers 1 or 2 weeks of treatment because there are shortages of medication.
Have you presented this data to the health department?
Yes, the department also came to the public hearing, and we also have a follow-up meeting that we're planning with the Gauteng Department of Health, and we've done the same with other provinces.
So there's a new health MEC in place now. Are you more confident?
We welcome the appointment of the new MEC. I'm not in a position to articulate if I think the leadership would be in more position to articulate on the appointment of MEC as an implementer. I think would speak about the confidence of the MEC when we see progress, when we see work being done, when we see change. We do not take credit on a personal capacity of a person.
Nonetheless, the figures are still very disturbing. Thank you very much for joining us.